In this video, we will be looking at the adult versus fetal blood circulation. This will be revisited to add more information when we look at the blood supply to the abdomen. But for now, we will concentrate on the differences as seen within the mediastinum. The aim for this session is to recognise the course of blood through the heart in an adult versus a fetus, which will help you on your learning objective to identify the embryological remnants of the heart. Firstly, let's look at the heart and identify some of the structures which we have already met within the e-learning package. We have the right atrium and the right ventricle, the left atrium and the left ventricle. Here is the pulmonary trunk that divides into the pulmonary arteries that take blood to the lungs. We have the superior and inferior vena cava, the pulmonary veins, and lastly the thoracic aorta that delivers blood to the rest of the systemic circuit. In the healthy adult, deoxygenated blood leaves the systemic circuit and enters the right atrium via the SVC and the IVC. Where it passes through the tricuspid valve and into the right ventricle, where it leaves through the pulmonary valve, through the pulmonary trunk, into the pulmonary arteries for gaseous exchange within the lungs. Oxygenated blood then returns to the heart via the pulmonary veins and enters the left atrium, before passing through the bicuspid valve into the left ventricle. It then leaves the heart through the aortic valve and rejoins the systemic circuit via the thoracic aorta. The fetal circulation is different. Oxygenated blood is received from the placenta and passed to the liver, which then courses into the right atrium via the IVC. In the fetus, there are two routes that the oxygenated blood can take. It can either pass through a hole directly into the left atrium, or it can pass through the tricuspid valve into the right ventricle. If it passes directly into the left atrium, it courses through the bicuspid valve into the left ventricle and through the aortic valve into the thoracic aorta for circulation. For the oxygenated blood that entered the right ventricle, the blood passes through the pulmonary valve into the pulmonary trunk. Again, there are two routes in the fetus. A large portion of the oxygenated blood travels through a shunt between the pulmonary trunk and the arch of the aorta, where it continues to be distributed throughout the body. Some oxygenated blood will travel through the pulmonary arteries to perfuse the tissues of the lungs in order for them to develop. The SVC and the pulmonary veins will return some deoxygenated blood to the heart for circulation, but this will go on to be exchanged within the placenta further along the circulatory system. The shunts employed within the fetal mediastinum are the foramen ovale, which allows blood to travel from the right atrium to the left atrium. And the second shunt is called the ductus arteriosus, that is located between the pulmonary trunk and the aorta. When born and the infant takes its first breath, The intrathoracic pressure causes these structures to slam shut. The foramen ovale is now referred to as the fossa ovale. The ductus arteriosus collapses and is referred to as the ligamentum arteriosum. This concludes the differences in the adult versus fetal circulation. We have covered the different courses of the oxygenated blood and the structures that have enabled this. When we look at the abdomen, we will add to this information to provide you with a complete comparisons of the adult versus fetal circulation.